We can analyze timelines for the cases and say, oh, this is according to the standard of care.
Right.
Like I had one case where a patient died after she was suicidal, and they hadn't watched her, and she overdosed. And I was able to tell the attorney, no, that is not standard of care for the psychiatric industry for what they were doing with this patient. And he was able to settle out of court.
Now, does one need to have a certain skill set or certain abilities, or can most everything in nursing be taught somehow?
Oh, I think everything in nursing can be taught. You need to be observant. You need to be suspicious of everything if you're going to be a forensic nurse. You need to understand that the evidence tells the story, not the person.
Right.
You look and see if somebody says, oh, I was raped on a grassy floor down by the river. Well, they have no grass stains on them. They have no mud on them.
Right.
You know, something's not right here. You
So
know,
it kind of sounds similar to a program like CSI.
it is very similar to CSI, except that we don't go with guns usually
Right.
out and arresting them. We let the police do that. But we work
Right.
very closely with the police and saying, you know, maybe you ought to look this and this and this. Also, sometimes we help the police put together clues. If there's like 2 or more patients that come into the emergency room, perhaps with herpes or with scabies or something like that, and we know that there's a victim out there, I mean that there's a perpetrator out there that is passing this along, and we can
Right.
describe it to them, and they can help to coordinate some of the casework together.
So tell us a little bit how you got started in writing books. You said this is your 32nd book. How did you initially begin?
Well, I started lying to my father. Now, the fact is that I have a very active imagination.
Okay.
I always had an active imagination. I love telling stories. And when I was in nursing school, I had this great idea for a short story. And instead of studying for a physics exam, I wrote it that night, and I published the short story, and I failed the physics exam. You know, and I actually didn't think, for a while, I didn't think I really wanted to go into nursing because I really loved writing. But
Right.
now I try to use my nursing ability to educate while I'm entertaining. And that's one of my goals, and that's one of my purposes in life, I think, is to educate people.
You're going to write another book?
Oh, yes. Well, the book I'm working on right now is called Everything for the New Nurse. It's from Adams Media. I'm also working on some more nursing detectives for young adult series.
Which is what this is.
Which is what this is true crime, though.
Okay.
These are true cases, except for the names of the characters.
Have been changed.
Names of the victims have been changed, yeah, the nurses too, and the locations, just so to keep anonymity. You know,
Right.
But that is true. Those are factual cases. But I also do fictionalized cases as well, too. I'm working on a case right now, too, down in Florida, where this woman is accused of killing her 5-year-old son, who we have reason to believe that the father was the one who did it. And set her
So
up.
how do you find out about these cases in order to put them in your book?
Well, some of the cases were some things that I worked on myself. Most of them were friends of mine from IAFN, the International Association of Forensic Nurses, who contributed cases to me and whose names I disguised in the books for the purposes of their patient's sake.
And then you basically just take the exact case, and besides like name changing locations?
Not the exact case. I took elements of, sometimes I took elements of one case and I mingled it with elements of another case.
Ooh,
sometimes I.
So you kind of create your own case
You know, sometimes I, just changed it around a little bit to change the language, or made a man a woman type of thing, just so that nobody would be suspect of who the case is really about.
So is there any ramifications legally that?
That's why I did it that way. That's why I did it that way.
So they won't even be able to tell?
No, exactly. That's why I did it that way.
So you said that you were thinking of going into writing instead of nursing. What drew you back into nursing, to go back into nursing instead of
Well,
writing?
I mean, I love helping people. I really do. I mean, on my tombstone it's going to read, everyone she came in contact with was changed for the better, I hope. At least I hope that's going to say that. But, I mean, the thing is I really do love helping people, and I really, I enjoy educating people as well. And actually, the fact that you don't make a lot of money being a writer these days yet.
Right. But you can keep trying.
I can keep trying, yes.
And you keep going on the path, but you keep doing what you love. And that's,
but I do love.
That's what's important.
Well, right now I'm doing psychiatric work. I'm working with an adult daycare center, and most of my patients are either mentally handicapped in some way, bipolar, depressed, suicidal, schizophrenic, you know, and I love talking with them and helping them to find the reality in their lives.
Right.
You know.
So what do you think that people should know about nursing before they kind of step in with full speed, or kind of what's like, it sounds like all great. It sounds like, okay, well, why wouldn't anyone want to do this? But there's been a short supply of nurses.
There's a lot of drawbacks to nursing. There's a lot of drawbacks. Well, first of all, the hours, the hospital hours. I'm a single mother, and thinking about going back to the hospital is very difficult for me because 7 to 3, I have no one to take my daughter to school.
Right.
3 to 11, I have no one to pick her up and to take her home and do her homework with her. 11 to 7, I need someone to sleep over and take her to school in the morning. So those hours are very difficult.
Right.
You know, also, nurses are still not given a lot of credit for what they can do. I mean, we are the eyes and ears of the doctors. The doctors come in, you know, for 5 minutes, see the patient, how are you doing, dear, what's going on? We're the ones that tell the doctor, you know, her vitals were this and this and this, she doesn't eat today, you know, we're really concerned about this and this.
But do you think that what prohibits people from being a nurse is because they don't get the credit?
Well, that's one thing, is that people think of doctors as having more status.
Right.
You know, oh, why don't you be a doctor? You don't hear anybody saying, oh, why don't you be a nurse? You know, and nurses are, you know, we have a lot of great men in nurses too, and they're not given the great, the PR that they really need to. And the majority of men are not gay nurses. There's quite a few married men in nurses.
I was going to say, you had that stereotype that, you know, the nurse should be a woman and isn't a man.
Well, that's because nurses have been mainly women from the past, and we're the nurturing sort. But the fact is that there are many men who are nurturing too, and they don't have to be gay to be nurturing.
Right. Oh, exactly.
You know,
I agree.
And there are many men that like the hands-on stuff and don't want to do the academic material that doctors have to go through.
Well, I think there's also a stigma with, like you had said, why don't you be a doctor? It's kind of like a nurse. I think some people may think a nurse is just kind of
an underling.
Yeah, well, a step down from a doctor. You couldn't make it as a doctor.
In England until just recently, in fact, my ex-husband worked in England for a while when we lived there, and he was, you know, he was constantly being catered to, but, you know, the nurses would stand up when he came into the room. They would say, Dr. Glassenberg, do you want your tea? You know, and it was just, you know, it was totally just very anti-feminist in many respects. You know, the nurses, you know, there's some of the third world countries, the nurses have a long way to go to get the respect that they deserve. Now, and our income, too, is not as great as doctors either.
Would you ever consider going to another country in practice nursing, or if a disaster strikes and they need nurses?
Well, actually, I was for a while part of DMORT, which is disaster mortuary operations, where we go and we help to recover the body parts, and like if there's a plane crash or like with tsunami, I'm sure DMORT was sent over there, and they set up temporary morgues, and they look and see and notify the family and talk to the families and help identify the bodies and help make, you know, smooth things over. Also, the disaster emergency teams do medical, you know, emergency medical treatment as well. So, you know, yes, I can do that, and actually I am part of a group in San Fernando Valley where I work for emergency setup as well.
What do you get out of being a nurse, you personally?
The knowledge that I am doing something to help another person, that my spirit is being passed on. Which
I think is so important, because a lot of people view a job as just that, a job. They're going to a job, they need some kind of income to pay the bills, and they're not doing it because they love it. They're not doing it because they're helping someone else out.
I mean, it is a real high when you feel like, when you have a patient that has been so confused, and suddenly she comes in and says, "Hi, Sarita," you know, you're like, "Oh my God, you realized my name," you know, like after 3 months of telling you. But I mean, it's just, you know, for somebody that's handicapped like that, you know, that's a big step for her. You know,
that's amazing. And just the feeling that you get back from it.
Right, right. You do get a feeling of good, you know. But the other down part is that many nurses are codependent too.
Or with what?
That we tend to want to fix everything and everybody, and sometimes we get into bad relationships. But that's a whole other story.
I was going to say, do you take it home?
Sometimes we do.
You take, like, if patient's not doing well, do you take that stuff home with you? So that may be a drawback too.
That can be a drawback too, yes. You have to learn.
Is that common though?